Hi, my name is Becky Zimmerman, and I'm a mother of 3 children, and one's 6 and one's 4 and 15-month-old. And with my first child, I had him at the Brantford General Hospital, and I didn't know anybody at that time that had ever breastfed a baby, so it was all new to me. And thank goodness we had a lactation consultant, Janice, and she helped me through it and got me started. And I think that if it wasn't for that, I don't think I would have had the support or strength to continue breastfeeding. Because of that, I've breastfed all 3 of my children. I can honestly say I could probably count on one hand the number of times my children have even had to go to a doctor in the last 6 years. They've been healthy and happy and very well adjusted, and I really do contribute a lot of that to the fact that they were breastfed. They don't even really barely get colds and that. So I really, when I found out that Brantford was canceling the lactation consultant, getting rid of them, I was totally shocked. I think that the long-term benefits of having a lactation consultant and helping women to breastfeed is, you can't even put a price on it. It's very needed in this community, and it would be a real shame if we didn't have a lactation consultant. I think that in order to breastfeed, women need support, and they need encouragement, and they need somebody that can provide them with good information. And doctors these days are just way too overwhelmed to be able to update themselves on all of that kind of information. So I really, really think that it's hugely important to have a lactation consultant. Thank you.
Hello, I'm Cale Laver. I just wanted to say a few words about the importance of having a lactation consultant here in Brant County. My wife has 2 beautiful children, and neither of them would have been able to breastfeed for the extended period of time that they were able to without the services of a lactation consultant. She was absolutely instrumental in ensuring that my wife was able to breastfeed after our children were born. It's common that women have problems, and these ladies are eminently trained to help them, and the fact that there is not one is simply unacceptable. So I'm just lending my voice to ensure that funding is put in place to ensure that there's a lactation consultant in place in Brant County. Thank you.
Well, breastfeeding was a huge, huge problem. I don't know if it was because of the C-section, if it was because of the medication that I was on, but I was having a real hard time. And I thank God for Janice, because she was at the hospital at that time.
Sorry, Janice was?
Lactation consultant. She's here today. And because of her, I was getting very depressed because I feel like I wasn't able to do anything for my daughter naturally. So because of her, we did start with formula in the hospital because everybody else there was making me feel very nervous that my baby was losing weight and she needed food. So being a first-time mom, I said, okay, but Janice came in and helped me. Right away they got me to start pumping because I wasn't able to get her latched on. So that saved me in knowing that I was at least giving my daughter something of mine. And then Janice stayed with me the 5 days I was in the hospital and helped me to do the best we could with breastfeeding. And so I was feeling much better as a mom, knowing that I was able to give my daughter the health benefits from breastfeeding that she needed. Once I left the hospital, I was still having lots of difficulty, so again, I thank God that she was in Brantford at the hospital. I could go see her when I needed to. We were still having lots of complications, and finally, my daughter Julia had a
Tongue tie?
The tongue tie. I just lost the name.
Yeah,
the tongue tie, and because of that, we finally realized, or Janice said, I think that is causing your biggest problem. So I went to Toronto. I had Julia's tongue, the tie clipped, and it was no problem at all. She didn't cry. There was no blood. Immediately, they put her on my breast, and she latched on beautifully.
Luckily for us, Janice was available 3 days a week, and we tapped into Janice's services as much as possible. We spent many hours in there breastfeeding, and just having Janice around was, for me, it was a comfort. I know that my daughter was able to feed better while we were there because she was more relaxed, because I was more relaxed. And it was very important for me to breastfeed my daughter, and without Janice's support, I don't think that would have happened. I feel badly for the mothers who are in the clinic or in the hospital now and wanting to access that service but aren't able to. The difference between the nursing staff and the service they provided, as well as the information compared to that of a trained lactation consultant, was very different. I think that Janice's attitude, first of all, I would imagine that Janice has a broader knowledge base than the nursing staff, as they weren't specifically trained to be a lactation consultant. So perhaps they had taken a course at some time in the past. Maybe they hadn't. Maybe they had been given some in-servicing along the way. But certainly Janice's knowledge base, to me, appeared superior to what the nursing staff had. As well, Janice was very persistent in trying to allow us to do everything we could in order to allow my daughter to breastfeed. So when one method wasn't working, she would suggest something else that we could do. Whereas the nursing staff, when it wasn't working, they would just kind of say to us, give her a bottle, she needs something to eat. We were really lucky to be able to access the outpatient services that they had at the hospital. Again, they were limited to 3 days a week. If it were available 5 days a week, I know I would have been there. And as well, other mothers that I knew, new mothers at the time, were also accessing the clinic. So it was very helpful, not just for inpatients, but as well for outpatients, because there really wasn't a lot of other support in the community. We were given a visit through the public health nurse, but that didn't seem so much as a coaching and support role as opposed to someone coming and looking in to make sure that everything was okay.
My name is Debbie Hunter, and I have 4 children actually that I've breastfed all 4 of them. And my oldest is 18 and my youngest is 4 weeks old. I also have a 2.5-year-old that has Down syndrome that when he was born, he did have some problems with sucking hard enough to bring my milk in. So if it wasn't for the lactation consultant here, that we would have stopped, because I was trying to breastfeed him pump and it was very difficult at that point, and she kept pushing us and helped us through the tough points, and if it wasn't for her, like I said, we would have stopped, and I'm extremely thankful that she was there at that point.
And how do you think breastfeeding benefited your son in that way?
He is extremely healthy. Down syndrome kids tend to get a lot of respiratory problems and a lot of feeding problems, and he is excellent. He's so healthy, and his development has been much better, I think, for that.
And you attribute that to,
yeah, absolutely,
to breastfeeding?
Absolutely.
That's wonderful. Is there... Okay. What was your reaction when you heard that the breastfeeding clinic in Brantford was closing?
I guess extremely disappointed. At the time that they had announced it, I was still using the lactation consultant services, so it was pretty disheartening to think that they would cut services from something so important with so many health benefits involved.
And with regards to your own personal experience, how do you feel a lactation consultant helped you?
I wouldn't have been able to breastfeed without her services. It was touch and go for the first little while because we had problems establishing the routine and the breastfeeding patterns. And without her help and her advice, I wouldn't have continued with it. It was very frustrating, and Janice really helped me through a lot of that.
Do you feel that she was easily accessible for you to use?
Definitely, yeah, definitely.
And how did it work? Would you just have to call, or would she come and see you?
She came to see me in the hospital shortly following the birth of my daughter. Made herself available during my 4-day stay in the hospital. Also, I was offered to make an appointment before I left the hospital to come back postnatal, and anytime that I called there, I was able to reach her almost right away during her hours that she was there. And I would make appointments while in consultation with her for the following time for follow-ups.
That's wonderful. Do you think it would have been different if you had gotten, say, advice from somebody in hospital and then had to see somebody different once you left the hospital and not had that continuity?
I think very much so, because I actually formed a relationship with the lactation consultant. I was comfortable with her. We talked about a lot of personal issues that I was having with breastfeeding in regards to family members looking down on the whole thing and telling me to quit, and she would kind of bring me back and bring my morale up and get me to continue on with it.
A lot of the advice that I got in the hospital from the nurses was that I would not be able to breastfeed because of a surgery that I had had done, and I wasn't offered any kind of support there, so it was definitely the place to be for me to keep going with the nursing.
That's wonderful. Is there anything else that you wanted to add to that, or?
I think that's it. I'm just really, I think that breastfeeding is really, really beneficial, and I think that it's a service that all women should have access to, especially since we know of all the benefits that breastfeeding has for not only the baby but for the mothers as well.
Do you think the government has a certain responsibility, seeing as they promote breastfeeding and tell women how healthy it is, and then what do you think their responsibility would be once the babies are born?
I think it's pretty ridiculous that they tell us how good it is for us, for the mother and baby, and for them not to provide a service to help establish that. It's not an expensive service. It's not fancy machines and different things like that. It's a consultant with maybe a scale and her knowledge, so it's not something that's very expensive. And it'll save money on the healthcare system in the long run. If you've got healthier mothers, healthier babies, why would you cut this service?
During those first few months of nursing, you need so much help and coaching to get you through that, so that you can have a successful 2 or however long you want career of breastfeeding. It's not the easiest thing, but you do absolutely need help with it.
Did you encounter any difficulties when you first started breastfeeding, or how did that go for you?
I did. I had my first son. I was overwhelmed by the whole experience. I had, the mastitis and this and that. So I certainly needed coaching through that to tell me that that was normal, to give me advice on how to get through that, and women need that.
Lactation consultants also have very specialized education and continuing education requirements that they need in order to fulfill and complete their registration and their certification within their fields. And while I would never downplay the importance of La Leche League, which has been very, very helpful to me personally over the last 4 years, and also of the services that are provided through the public health unit, the medical expertise and knowledge that the lactation consultant carries is crucial, I think, to the information and the input that they give. And given that that is what they do for their job, their experience is not diluted down. So a nurse on the ward might deal with a few moms who are working at breastfeeding and may give generic suggestions to every mom, whereas an LC is able to specialize her input based on that mother and that baby, which I think is really important because it's not a one-size-fits-all. Information that is out there says that one of the biggest reasons that women stop breastfeeding or don't even try breastfeeding is because they don't have adequate information and support. And lots of people assume that physicians and people in the community are, I shouldn't say experts, but have lots of experience and information about breastfeeding and breastfeeding techniques. And I think lots of people know that breastfeeding is optimal from a physiologic and a biological and an ecological point of view, but may not necessarily have the skills that they need to be able to support women adequately to be successful and to maintain breastfeeding for an optimal period of time. So I just want to really advocate strongly that I think that this service is crucial for the health of our children, for the health of the moms, and for the environment and everybody in general.
Many communities across the province are having to fight, just as we are, to reinstate publicly funded lactation consultants for women in Ontario. Women have heard the message about breastfeeding loud and clear. They know that it's the healthiest thing for their babies, and they're committed to trying to breastfeed. The problem is, most women require support with breastfeeding, many requiring hours of extensive support, especially when breastfeeding is complicated by other conditions, like difficulty latching, Down syndrome, maternal health issues, or prematurity. Lactation consultants are trained, internationally certified breastfeeding specialists who can assist women having breastfeeding problems. And this is important as well, they're resources for the community, for healthcare providers, and for women to turn to when they have questions, so that we have a local, centralized voice for answering questions about breastfeeding. Supporting increased basic breastfeeding knowledge amongst frontline healthcare workers like doctors and nurses is very important, but it does not negate the importance of having a breastfeeding specialist available for referrals of difficult cases. Just training people in basic breastfeeding is wonderful. We need that too, but it doesn't mean we don't need someone that we can refer our difficult cases to. Healthcare providers and women alike need an identifiable expert to turn to for breastfeeding leadership and expertise. It has been 10 years since the tragic death by dehydration while breastfeeding of Claire Azzopardi at 11 days of age. People may remember that in Guelph. The coroner's recommendation arising from this tragedy that lactation consultants be employed by all hospitals doing deliveries in Ontario and that they should have a breastfeeding clinic in their hospital appears to have been forgotten in Brantford. What our group, the Lactation Consultant Working Group, wants is for people to stop passing the buck. Someone needs to step up and take the lead. Yeah. Someone needs to step up and take the lead in reinstating publicly accessible lactation consultant services in Brantford and Brant County. Right now we're focusing on the province to take a leadership role in ensuring the provision of lactation consultant services in Ontario. What we want the ministry to do is to take a leadership role and to help communities in their fight to reinstate publicly funded lactation consultants. Given the overwhelming health benefits of exclusive breastfeeding, increasing breastfeeding rates would result in massive cost savings to our healthcare system. This has been shown time and time again, and the ministry themselves say they want to increase breastfeeding rates to 50% at 6 months by 2010. And how does cutting breastfeeding services help that goal? Every woman deserves access to a breastfeeding specialist when she's in need. So thank you guys so much for coming out. Sign the letter, sign the petition, go in the speaker's corner if you want, and have your voice heard.
Thank you for this opportunity, and I also want to indicate to you that I've been meeting with the working group and that I fully support what you're asking as an organization, but more importantly for the kids. I can't tell you what a joy it is and a very, very special feeling it is to be around babies. You mentioned it, I did remind him that we have objectives as a government that we're not going to be able to meet as readily without lactation consultants. So to have us be together is the best option for us, for healthier babies. We know all the science. We know the science. We've known this for maybe thousands of years, hundreds of thousands of years, that there was a natural connection and there was a relationship between healthy children and what we did with breastfeeding. Our research is very clear. Our third-party research is very clear. The healthiest, the cheapest, the most efficient, effective way to keep our babies healthy is to attach them to the mother's breast. And want to make sure that you know that the blue shirt is not but I honestly believe, and you can get the picture of this, that's what we need.
Just want to make a couple of points. First, from a city's perspective, we strongly support a lactation clinic being here in Brantford. I was speaking to another grandmother this morning, and she said to me, just saying about her daughter, who had all kinds of lactation problems but had to leave town to get help. Yes. And the difficulty with that, it just doesn't work. It's like us having an MRI machine. Brantford's big enough, surely to God, we can have all of the things that are necessary for our city, whether it be MRIs or lactation consultants or just the assistance that we need. So
we need to hear from you, and it makes a difference. It makes a huge difference. Your presence here, your continued support of this cause, the signing of petitions, I tell you, it makes a significant difference. And it's trite to say that every parent wants the best for her or his child. Absolutely. And there's no question in my mind but that the medical science indicates that the very best for a child for the first several months absolutely is to be breastfed by his or her mother.
As our elected officials, we are asking for you to act to reinstate publicly funded lactation consultant services in Brantford and Brant County. This issue needs your urgent attention before more breastfeeding women fall through the cracks.